Hello, my dear doctor. I'd like to talk the COVID-19. The world is now in the moment of crisis. And this kind of pandemicity that we never experienced in our life since our childhood, my dear. We learned about some of the pandemicities occurred, but these kind of experiences, we never have any experiences. So before starting the COVID-19, I'd like to share one of the important talk. That is, that 7 days back, I got a fever and having a sore throat. Immediately after that, I felt it, I had the fever and having the sore throat. I stopped everything. I stopped to take the classes and I stopped to see the patients and I stopped everything to go outside and I confined myself at home. And for the last 6 days, I'm at home. And I suspected myself as a normal flu. Even though I suspected normal flu, then I did a CBC, the complete blood count, to see the specific lymphocyte count, especially whether it's lymphocytosis or maybe the lymphopenia. Usually the lymphopenia in case of COVID-19 can be found. So I just did a screening test for the CBC. And I found everything quite normal. And I felt it, yes, I'm not having the chances to get contracted with the virus like COVID-19. But even then, before the 7 days, I saw a huge number of the patients. So a bit of frightening is also going on around in my mind as well. So, but even then what I did actually, even though if we feel that if you have a normal flu, so we should contain and we should keep ourselves at home. Because during the time of normal flu infections, our body immunity getting down. And there is a heavy chances to get contracted with the COVID-19 like viruses that you can get the infection. So that's why I just at home. And since yesterday, I feel better and the fever subsided, no sore throat at this moment. And I hope that with the blessings of all of you guys, with the Goddess Supreme Personality, by the nourishing of that. So yes, I felt that I am recovered. Yes, my dear doctor, I've come forward with one of the important talk. That is the treatment. But before starting the treatment talks, I would like to come forward with the pathophysiology. Because the understanding the pathophysiology of this COVID-19, how it infects us, the lungs get infected and can cause a serious condition. We call it the ARDS and even the severe pneumonia or severe acute respiratory infection. We call the SARI or the pneumonia. So we'll understand them better. And after that, we'll talk about a little bit about the treatment. Yes, because the COVID-19 is a hot topic in each and every houses, in each and every peoples in all over the world that we are experiencing nowadays. Everybody is at home and everybody knows actually, yes, how to prevent this, all these things together. And yes, the governments, non-government organizations, and also the CDC and all the WHO, all the organizations are working together to fight against this COVID-19. So yes, my dear doctor, before going to the pathophysiology, it's a very important things. I'd like to show the world current trends, what's going on, the number of cases. Yes, my dear doctor, just come forward. Look at here. Yes. So yes, you see here, I'd like to show here the coronavirus cases, more than 5 lakh cases. And this is the 26th of this March that video is making on. So yes. So the deaths is more than 22,000. So 22,342. And then if I'm going to the country-wise, if you see the yesterday, the Italy and the USA, the current country, the Italy, you see the Italy is 74,000 cases, the US in the 68,000, but now the USA gets up, the 75,000 and Italy is getting down. And in Italy, every day for the last couple of days that we are seeing that, the highest number of the deaths all over the world, and they are breaking the old records. And this is such a crisis is going on, and this devastating destruction is going on in Italy. And now the USA is suffering and getting the new cases, number of cases and number of deaths as well. Yes, now I'm now turning back to the main focus here. There is the COVID-19. I'd like to talk. You see that this kind of virus, that the COVID-19 is a coronavirus. Beforehand, that we got in 2012 the MERS virus, Middle East Respiratory Syndrome virus, and in the year of 2003 that we got the SARS virus, and this is the same SARS virus, but because of these mutations that we got the new virus, or we call the novel coronavirus, that is the coronavirus disease 2019. And this coronavirus, one of the important talk that I'd like to add here, we were going to the pathophysiology, and it said that it comes from the bat, because this virus usually lives in the animals, like in the bat, and the first host and the next host, the intermediate host, there is a pangolin. And then the human. So it is thought that comes from the bat, then the pangolin, and then to the human. Because of this mutation, the viral changes in the genomic gene changes, the mutations, the virus gets like aggressive and the virulent nature is changed. And I'd like to show one of the important properties of this virus. There's the R0. It does mean the reproduction number. And this reproduction number we can compare with the influenza viruses, with the COVID-19. The reproduction number of the COVID-19 is 2 to 3. In contrast to the influenza is 1.3, means 1. It does mean an infected person can infect up to 3% altogether. And you see the chain of the next 3%, each every person the 3, so the next will be the 9% altogether. And the 9%, 3 into 9 equal to 27% altogether. So this is the COVID-19, the important property is the statistical term, there is the R0, the reproduction number. You see this is very high in contrast to the normal influenza, where the 1% infect only one, and then another person will infect another one. In contrast, in this cycle, in the 3 cycle, you see the 1, then the 3%, the 9%, and the 27% altogether, and you can multiply 27 into 3. So you can feel that how many numbers of the peoples can be affected. Yes, my dear doctor, I'd like to talk, very importantly, there is a pathophysiology. Let me start by the pathophysiology, but beforehand the pathophysiology, I'd like to show the coronavirus. This coronavirus, this is the structure of the coronavirus. The name of the corona comes from the structure shaped like the crown. So yes, my dear doctor, you see the crown shaped, and sometimes somebody says the sun rays, so the sun-like structure. So is a coronavirus. And this coronavirus, you can see, this is the nuclear material, that is the single-stranded RNA, and there is some protein inside, and there is a cover, you see, is a green color cover. We can say the capsid or nucleocapsid, and then the outside another cover, and there are some spikes are there, and we call it, this is the spike protein or S protein. So yes, my dear doctor. So this is the virion or the viral structure, is the COVID-19. So COVID-19 is said that the transmission, from the human to human transmission, can be through the fecal-oral route and through the respiratory droplets. And it is said that these respiratory droplets can infect another person up to 3 to 6 feet distance. And it says that these droplets, when you cough, sneeze, these droplets on the surface on the table or maybe on the chair or wherever, and that can survive at least the 24 hours. And recently it is said that this coronavirus can be also infected and transmit through the airborne transmissions, and that can leave the 3 hours in the air. So yes, whatever the ways, the fecal route or maybe the respiratory droplets or the airborne, the infections that gets into our windpipe, there is the trachea, then the bronchus, and the right and left side of the bronchus, then getting down to the smallest unit, the small unit, that is the alveoli. So they get access into the alveoli. So I'm showing here the alveoli. Here you see the alveoli is one of the alveolus. And these virus enters into the alveolus. And inside the epithelial cells are there, you see the lining epithelium. And there are two categories of the cells, especially I'm talking about these one. There is some of the spikes you see, some of the villi. This is called the type 2 pneumocytes. And these are the cells, the lining epithelium, this is called the type 1 pneumocytes. So the coronavirus gets access into the alveolus, and their target is the type 2 pneumocyte. And this is the type 2 pneumocyte, this is the type 2 pneumocyte. So I am showing you in the paper, you see this is the type 2 pneumocyte. And this is the coronavirus. And I say this is the spike or S protein, this is the special protein. When this virus comes in contact with the villus or villi structure of the pneumocyte type 2, there is a receptor, we call it ACE2 receptor. And this ACE2 receptor, there is the angiotensin converting enzyme 2 receptor. And this receptor is responsible for the fusion of this virus and gets access into the pneumocyte. And they leaves the covering of the membranes. So the COVID-19 pathophysiology, in this part that I'd like to show the pathophysiology, what starts with the COVID-19. You see, this is the structure of the COVID-19, the coronavirus. This coronavirus, the name of the coronavirus comes from the word, the corona, and this corona means that there is the, you see the sun ray shaped, and some people say that this comes from the word of the crown shaped structure. So you see this is really a crown shaped structure, and inside there is a nuclear material, there is the single stranded RNA and some of the dotted proteins are there, and there is a cover, and this is the nucleocapsid, and another cover is the red color you see, and other spike proteins are there, and this spike protein is important, we call the S spike protein. So this is the virion or the structure of a virus, or the coronavirus. And this coronavirus transmission can be fecal-oral route or can be the airborne respiratory droplets. And these respiratory droplets, whenever the people are coughing, sneezing, and that can travel 3 to 6 meters to infect another person. And it is said that these respiratory droplets, if it is placed on the surfaces of the table or chair or whatever the surfaces, and these droplets can survive at least the 24 hours. And recently it is said that this can be transmitted to the airborne as well. Means this virus can survive 3 hours in the air. So it can infect to the airborne infections also. So yes, whatever the ways the virus that enters to the trachea, the windpipe, then the bronchus and the branches, the bronchus into the lungs and directly into the alveoli. So the target is the alveoli, the smallest structures of the lungs. And I'm showing, you see the alveoli here, and I'm showing these alveoli in a big better so that we can understand the things better. So this virus enters into the alveoli. So this is the alveolus, and I am showing this alveolus. Inside there is a lining epithelium, and these small lining epitheliums, this is called the pneumocyte type 1, and another pneumocyte, this is a type 2 pneumocyte having some of the villus. You see the type 2 pneumocyte, these are the type 2 pneumocytes. So yes, my dear doctor, this coronavirus having the target mainly first to the type 2 pneumocyte is the first target. And how it gets enter into the type 2 pneumocyte, you see here. So this is the coronavirus, this is the spike protein, the S protein, and this is the villi structure, you see, the type 2 pneumocyte. And this virus with the spike protein, with the help of the ACE2 receptor, this virus enters into the cell. What I said once again, ACE2 receptor. This is important that we need to remember. Angiotensin converting enzyme 2 receptors. With the help of the spike protein that fused with these ACE2 receptor, this virus enters into the cell, but they enters with this nuclear material and they left behind this covering. Only the nuclear material is the single-stranded RNA. And immediately after this single-stranded RNA enters into the cell, this goes into the two important procedure and two important changes. With the help of the RNA-dependent RNA polymerase, once again, RNA-dependent RNA polymerase, that makes the many single-stranded RNA. The word itself says that RNA-dependent RNA polymerase, so polymerization. So the many RNA will be produced. And with the help of the ribosomes producing translated to the many proteins, you see the different colors of the proteins, and with the help of the proteases, the enzymes, they are making, you see the COVID-19, the coronavirus, some of the coverings they are making, and also some of the spike proteins. So once again, what I'm saying, after entering the virus, after entering into the cell, the single-stranded RNA enters into this two important procedure. With the help of the RNA-dependent RNA polymerase, they are making many single-stranded RNA. And with this procedure, with the inside, the host cell ribosomes causing translation and producing many proteins, and these proteins goes with the help of the proteases. So I'm focusing here with these RNA-dependent RNA polymerase and the proteases enzymes. And these with these protease enzymes, you see that the different colors, the coverings of the coronavirus and also the spike proteins are produced. So with the help of this single-stranded RNA and these coverings and the spike protein both together, making these new coronaviruses. So these are the newborn coronaviruses. And these newborn coronaviruses are produced. So once again, as I said, that the coronavirus enters into the alveolus, and the target is the pneumocyte, type 2 pneumocyte, and enters into the type 2 pneumocyte with the help of the ACE2. And this goes to the two important procedures. You need to remember the RNA-dependent RNA polymerase and the proteases. And they make the newborn, new coronaviruses. And these coronaviruses within the alveoli, you see, if you take these new coronaviruses, and these new coronaviruses coming out from the type 2 pneumocyte, they are inducing the immune mechanisms of our body. The first, the macrophage comes forward. They are the police, RAB, or somebody, something like that. They are responding, the innate response. So yes, this macrophage comes forward in response to the many coronaviruses. This macrophage comes forward and they're releasing the 1,6 and tumor necrosis factor alpha. That is the interleukin 1, interleukin 6, and tumor necrosis factor alpha. These are the productions of the macrophages. And these interleukin 1, 6, and tumor necrosis factor alpha are responsible. You see the alveoli just near to the blood vessels. And these mediators causing the vasodilation and increase the capillary permeability. Once again, in response to the coronaviruses, macrophages comes forward, they're releasing interleukin 1, interleukin 6, and tumor necrosis factor alpha, and they are affecting the blood vessels, causing the smooth muscle, affecting onto the smooth muscle of the blood vessels, and also the endothelial cells, they get contracted. And whenever the endothelial cells are contracted, smaller, so there will be the pores here, so the increased capillary permeability and the vasodilation. And these vasodilation and increase the capillary permeability, you see, so the fluid will come out from the blood vessels in the interstitial space and also into the alveoli. That leads to the increased alveolar edema. If many alveolar edema will be there, that leads to the acute respiratory distress syndrome. And these acute respiratory distress syndrome occur whenever each and every alveolus of the both lungs will be affected altogether. So this is the acute respiratory distress syndrome. It's a serious complications. And also, this is very important. Next to the macrophage, the neutrophils also come forward as a defense mechanism. These neutrophils are releasing the reactive oxygen species and also the proteases. And these reactive oxygen species and proteases are damaging the other pneumocytes, means the type 1 pneumocytes of the lining epithelium of the alveoli. And that leads to the damaging the alveolus. And whenever the lining epithelium is damaged and the outside there is a fluid and inside there is a fluid also, that leads to the alveolar collapse. So the fluid gives the pressures and inside the alveolar epithelium are damaged, that leads to the alveolar collapse. And these alveolar collapse leads to the hypoxemia, means the partial pressure of oxygen will be reduced, means the hypoxemia, means the gaseous exchange will not be occurred here adequately, that leads to the hypoxemia. And this hypoxemia leads to increase the work of breathing, and that leads to the shortness of breath. And this hypoxemia means the partial pressure of oxygen reduced, these responding to the chemoreceptors to stimulate the sympathetic nervous system, that leads to the heart rate and the respiratory rate to be increased, tachycardia and tachypnea. In response to the coronavirus, as I said, the macrophage comes forward. They are causing the interleukin 1, interleukin 6, and tumor necrosis factor alpha. And they are causing this vasodilation, increased capillary permeability, that leads to the alveolar edema, then ARDS and alveolar collapse, that leads to the hypoxemia, shortness of breath, and partial pressure oxygen reduced, that leads to the heart rate and respiratory rate will be increased. And in response to this, interleukin-1 and interleukin-6 and T1 necrosis factor alpha that causing the hypothalamus, yes, to set point of the temperature that leads to the fever. And also in response to the macrophage and also the neutrophils, as I said. Now the many neutrophils and the inflammatory cells within the alveoli that leads to the consolidation, and we call it severe acute respiratory infections or pneumonic consolidation, and that leads to the cough and sputum. So knowing these facts, that we can understand now the coronavirus, whenever they infect, they start with the fever, the most common symptom, and having a cough and sputum and shortness of breath. These are the most common presenting features. So what I say, the fever, cough, and the shortness of breath. If I'm saying the fever, shortness of cough, and shortness of breath. Fever, cough, shortness of breath. And if the consolidation means the severe acute respiratory infection, sorry, that the pneumonia and all the alveoli are having the edema inside and outside and causing the interstitial fluid, and that causing the alveolar edema that leads to the ARDS. These are the important complications. So next to them, the extreme, the vasodilation and the increased capillary permeability. So what will be affecting here in the cardiovascular system? So definitely the increased capillary permeability that causing the reduce the venous return, and because of the vasodilation reducing the peripheral vascular resistance, and that leads to the reduced cardiac output and also the blood pressure. There is the hypotension, means the shock. And this shock leads to the hypoperfusion, and this hypoperfusion leads to multi-organ failure. Yes, this hypoperfusion can cause the kidney failure, and this hypoperfusion can cause the liver failure, and this kidney failure leads to the urea electrolytes will be erupt, is raised, and liver failure can cause the acute liver failure. There is a bilirubin, LTST will be erupt. So yes, the cardiovascular shock, there will be the shock, there is a septic shock, we can say, in the hypotension, multi-organ failure, renal failure, and the liver failure. So these are the pathophysiology. Knowing these facts of this coronavirus, of this pathophysiology, will be helpful to understand the treatment targets. Recently, we don't have the very satisfactory treatment or very recommended treatment in our hands, but in near future, maybe you will get the very good treatment in our hands, knowing these facts of this pathophysiology. So I'm focusing this pathophysiology once again, a quick recap. So starting with the S-spike, with the help of the S-spike, the target the type 2 pneumocyte, and these with the help of the type 2 pneumocyte, the ACE2 receptor enters into the cell with the RNA-dependent RNA polymerase, and with the help of the proteases, they are combining together many new coronavirus. And these coronavirus responding by the macrophages, releasing interleukin-1, 6, and alpha, and that causes the vasodilation, capillary permeability, ARDS, and also the capillary alveolar collapse, hypoxemia, shortness of breath, and also the partial oxygen reduction, there's the tachycardia, tachypnea, and also having some of the many neutrophils are come forward. They're also damaging the alveolar cells, means the pneumocytes, lining epithelium, the reactive oxygen species, and the proteases. With them cause the alveolar collapse, and also the many neutrophils and all the macrophages causing the sputum and cough and causing the consolidation, SARI, and pneumonia. So the pneumonia as well as the ARDS is the most important complications other than the fever, cough, and the shortness of breath. And so the summary talk, the clinical features, if you think about the fever and the cough and the shortness of breath, along with that the pneumonia and the ARDS, and the other multi-organ system failure, the kidney failure, and also has the liver failure. So this is the pathophysiology that we need to understand very clearly so that we can target the treatment. So we have some of the few treatments at this moment that are using, and some trials have been shown some of the promising effects of some of the treatments. So I'd like to show here the ACE2 receptor. So this is one of the drug that is the chloroquine. So just remember the chloroquine, C for C means the ACE2 receptor here. So the chloroquine acts with this entry, means prevention of this entry of this virus. So no entry, so yes, there will be no replication of the viruses. So it's promising. So the chloroquine or hydroxychloroquine is a drug which helps to prevent the entry into the cell, and also another effects that you can say this virus, this internal activity like the viral replications are dependent on the inside, the pH, means the acidity, means the virus needs, means the structures need the acidity, acidic environment. And this chloroquine inhibit this acidic environment. It does mean they reduce the acidic environment, reducing the viral replications. So the two important works that you can remember, this chloroquine inhibits the entry. Number two, the chloroquine. Some of the important medications are used in a different trials and showing some of the promising effects in coronavirus. So I'd like to just show some of the mechanism of action, how they works actually, so that we can understand the things better. As because you have already seen the pathophysiology, how the virus enters into the cell and then goes to the replication procedure to make the new viruses. So the target, the three important targets here, the number 1, number 2 here, and number 3 here. So the first target is the chloroquine or hydroxychloroquine, is the entry point. You see the ACE2 receptor. So hydroxychloroquine inhibits the entry of the coronavirus. So no entry, no replications. And also the replications of the virus within the cell needs the acidity or acidic environment. This chloroquine or hydroxychloroquine inhibits the acidity, means they reduce the acidic pH, means they increase the pH. So it does mean the two important actions of this chloroquine hydroxychloroquine, the number 1, that inhibit the entry of the virus in the cell and decreasing the acidity. So as I said, the chloroquine and hydroxychloroquine, the acidity and the ACE2 that we can remember. And the second drug is remdesivir and ritonavir. The remdesivir is work here. The second target is the RNA-dependent RNA polymerase. So R for remdesivir, R for RNA-dependent RNA polymerase enzyme. So that inhibits this enzyme. So there will be no single-stranded RNA. Many RNAs are there. So no polymerase will be here. And another one is the ritonavir. I call it the pitonavir, so that you can remember the P for pitonavir, P for protease inhibitors, because this is the potent enzyme inhibitor as well. So the ritonavir is used in the antiretroviral treatment in the HIV treatment, my dear, but this is action against the protease inhibitors, so there will be no protein breakdown making the new viruses. So the three important drugs, once again, the chloroquine, hydroxychloroquine, the entry point, the C for chloroquine, hydroxychloroquine, the C for acidity, C for ACE2, remdesivir, RNA-dependent RNA polymerase, and pitonavir is a protease inhibitors. These three important drugs that we can remember, and these are used in the different clinical trials. And now saying that these drugs should be trialed on a large scale basis so that the effectivity can be known much more better for this virus. Let's see and what's going on in near future. But these are the pathophysiology, knowing this pathophysiology very well, so that we can target the therapy, inhibit the replications of the viruses and inhibit the actions altogether.